Okay. Hi, my name is Madison Terry, and I'm here to do my video validation too for PCA pump is what I'll be doing today. So I just wanted to tell you guys that I printed out my physician's orders. So I've got my physician's orders front and back. I've got my PCA protocol front and back, and I've got my my MAR front and back. Okay, so after I've done that, the first thing that I'm going to do is verify my policy and procedures for my facility. After I've done that, I'm going to compare my physician's orders against my MAR. So what I'm doing today, I have Cecilia Proctor, MRN number 2985601. Those match. So what I'm going to be doing today is a PCA pump setup with morphine sulfate. The concentration is 1 milligram per 1 milliliter. That's what it says on the MAR. We've got a continuous rate of 0.5 milligrams per hour ordered with a supplemental demand bolus dose of 1 milligram. The lockout interval is 10 minutes, and the maximum dose is 24 milligrams per 4 hours. That means she can get a max of 6 milligrams per hour. No other opioid can be given during this time, and I need to call the physician if the pain is unrelieved, stop PCA pump if respirations get below 8, and reassess the pain every 24 hours, but I would be reassessing more often than that. So after I've checked that and those both match, what I'm going to do is go into the med room. I'm going to do some hand hygiene first. So I've got my medication picked out. So I'm going to compare this against my MAR. So I've got my label here. I've got Cecilia Proctor, MRN number 2985601, 2985601. I've got the right patient. The drug is morphine sulfate. The concentration is 1 milligram per 1 milliliter. You got that? So that's the dose. The route is IV, and the time is now. Checking the expiration date. That looks good. The expiration date is tomorrow. Doesn't look tampered with, and I've done my first med check. After I've done my first med check, it's time to go into the patient's room. I'm going to gather up all my materials, including my medication, which will include my PCA pump tubing, alcohol wipes, clean gloves, hand hygiene, my documentation. I will also have a pen and a flash. I will definitely bring a flash because I need to connect them. So we're all set to go. I have all my materials in. There are my materials. Okay. Knock, knock, knock. Hi, Cecilia. My name is Madison. I'm going to be your nurse today. Today, I'm just here to set up a PCA pump for you. I will explain what that is in just a moment. But could you tell me your name and your date of birth? So she tells me her name is Cecilia Proctor. MRN number is 2985601. That matches my MAR. And I've got a birth date, XXXX19XX, that matches, and she has no known allergies. Cecilia, are you allergic to anything? Just confirming that she has no allergies. See, we are good there. No allergies. So I just wanted to explain to you what a PCA pump was. That stands for patient-controlled analgesic. So that means you're going to get a button and you're going to be able to push for some more morphine. And that's what we'll be giving to you today. So you'll get a little remote. When it's green, you can push it. Then that'll give you an extra dose of morphine. All the while, you're still getting a continuous infusion of morphine too. Just to control that pain, you need to let me know if the pain is not relieved by what we're doing, so we can call the doctor and hopefully get that worked out. You also need to make sure that you leave your pulse ox on. So she's got her pulse ox on her finger. That's got to stay on because this can cause respiratory depression. I need to make sure that your respirations don't get too low and that you're getting enough oxygen. All right, do you have any questions before I get started? No? Okay. So I've got all of my stuff going. I need to make sure I have a infusion already going of 0.9% sodium chloride running at 10 ml per hour. So on my physician's orders and my MAR, I've got 0.9% sodium chloride or normal saline at 10 milliliters per hour already running. Perfect. So next what I'm going to do, I'm going to perform some more hand hygiene. And I'm going to assess this IV side of hers. So Cecilia, are you having any issues with your IV? Is it hurting you at all? Or do you have any discomfort? She would tell me no, and I would look at it. So it doesn't have any signs of infection. It's not red. It doesn't have any sign of infiltrate, which is really good, and this is flowing really well. So after I've done that, we're going to perform hand hygiene. I'm going to don my clean gloves. Okay, sorry, these gloves are a little old. So I'm donning my clean gloves. And what I'm going to do next is do my second med check. So I'm going to come over and check my medication again. This is my face, sorry. And I'm going to check it against my MR. So I have MRN number 298-5601. That matches. I've got Cecilia Proctor still. Got that. She's still Cecilia Proctor. Morphine sulfate. The dosage is 1 milligram per 1 milliliter, so we're good there. That matches. It's IV, and the time is now. So I've done my second med check, and I'm still checking expiration. It still looks really good. So after I've done my second med check, I do have to have a second nurse check. So my second nurse would come in. So I have Cecilia Proctor here. She's getting a PCA pump of morphine. So I've got morphine 1 milligram per 1 milliliter, and it's given IV.
Correct.
Okay. So I've done my second nurse check. So now I can do my third med check, which would be with the patient and my medication. So I'm going to scan the patient's wristband and scan the medication. So after I've done that, I can move on to setting it up. So what I'm going to do first, when I have my clean gloves on, I'm going to open up my tubing. I would make sure everything's clamped. So everything is clamped, it's all rolled out. We are good there. So the first thing that I'm going to do, I have this Y site, and I need to hook up my normal saline flush to the Y to make sure I flush my line. So I would open up my normal saline flush, making sure to maintain sterility. I'm going to uncap and place that down on the table. I'm going to push all the air out of my normal saline flush, and I'm going to hook that up to my Y site. So what I would do is I would make sure that I maintain sterility. I would uncap my Y site, and I would hook up my normal saline flush. I'm going to flush that until I see a few drops out the end. And I saw a few drops, so we're good there. And then I would leave that like that. So that's all hooked up. Next, what I'm going to do is hook up my morphine. So I still got morphine for Cecilia Proctor, 1 milligram per 1 milliliter IV now. And what I'm going to do is I'm going to uncap my syringe and hook that up to my tubing, and I'm going to flush it, making sure when I flush that I don't lose any medication. So I've seen a few drops out, and that looks good. So now I'm going to set that aside. Next thing I'm going to do, so I've done my prime, so now I'm going to move on to my pump. The first thing that I have to do when I'm doing my pump is place my syringe in my syringe pump. So I'm going to make sure we have the key there. We do have the key there. We're going to open this up, slide our syringe in with the label out. So I've got my label out, and then we're going to shut that. Next, I'm going to turn my key and turn this on. I would then push my channel select. My channel select would say new patient or old patient. I would say new patient. And then when it said the new patient's name, I would actually put in their MRN number, which is 298-5601. Okay, so I'm going to put that in. And then I would push confirm. And then it's going to ask me to choose my med. So I'm choosing morphine, and I'm going to make sure, yep, I still got morphine. So I would confirm that. It's going to ask me for acute or chronic pain, and I'm going to say this is for acute pain. Next, it's going to give me a clinical advisory, and it's just gonna make sure that I have that pulse ox on and that there's a risk for respiratory depression. So I made sure to educate Cecilia Proctor on the reason why she has to keep her pulse ox on. I made sure that it's still on. It is still on her finger. So then I would push confirm for that. Next, it's gonna ask me to choose a concentration for my morphine. So I've got 1 milligram per 1 milliliter, and that is correct. I'm looking at my syringe while I'm doing this too. And I will push confirm. Next, it's gonna ask me for a mode. So we're doing supplemental bolus doses, and we're doing continuous doses. So I would choose that. Next, I'm gonna move on to putting all my information into my pump. So what I'm first going to start out with is my PCA pump dose, which we know, looking at my MAR, that it is 1 milligram, okay? So I've got 1 milligram PCA dose. My lockout time is 10 minutes, so I'm gonna put that in. So that means every 10 minutes, she's gonna get, if she pushes the button, she will get 1 milligram or 1 milliliter of morphine. Next, I'm gonna put in my max, so which is 24 milligrams in 4 hours, which means she can get up to 6 milligrams an hour. And then I'm gonna put in my continuous. So I put in my continuous as 0.5 milliliters per hour. Okay. So next I'm gonna have to, before I do anything else, I need to get another nurse check. So can I get another nurse check, please?
Correct.
Okay, perfect. So I got that second nurse check, so I can move on. So before I push confirm and run for this, I need to do a couple steps. So I'm going to pause my 0.9% sodium chloride. So that's paused, I'm good there. Next, I'm going to clamp the 0.9% sodium chloride and leave that like that. What I'm gonna do is take my tubing that has my normal saline flush on it. I'm gonna unattach the flush and unattach the normal saline line that's running. I'm gonna hook up my normal saline line to my PCA pump tubing at that Y side, making sure to maintain sterility. Those are all hooked up together. All right. And then I am going to take my alcohol wipe. Got my alcohol wipe. Wiping it down, wipe, 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 wipe. For 30 seconds, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, and I can throw that away, making sure this still stays with the sterility. I'm going to take my end of my Y tubing and I'm going to hook it up to my patient. So I've hooked it up to my patient, making sure that maintains sterility and cleanliness. So I've got that all hooked up there now. And then I can unclamp and unclamp. I would push run or unpause for my 0.9% sodium chloride, so that's running. And then I could push confirm and run on my pump for my PCA pump. So after I've done that, everything's running. I'm going to go ahead and clean up my material. So I'm cleaning up my area, making sure everything gets thrown away. You're all clean here. Cecilia, so I am going to give you this remote that has a button on it. When it's green, you can push it. So make sure you are the only one that's pushing this, okay? Nobody else can push this for you. You need to let me know if you start to feel dizzy or lightheaded or are having a hard time with breathing. If you need to get up, you need to let me know. And so I've got your call light here, which you'll push if you need me whatsoever. Please don't hesitate for that. Do you have any questions before I go? No, she doesn't have any questions. Okay, so I clean up my material. Making sure this is locked. Taking my key with me, so I've got my key. And then I would unprovide for privacy. And then I'm going to do my documentation. So my documentation includes my initials, the date, the time, how the patient tolerated it, the education was provided, and that the procedure went accordingly. And then I am all done. Thank you.